This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
And welcome back, everybody. She has a wealth of knowledge. This all started with a chiropractic practice, but now has turned into essentially a wellness center in Florida, specifically around St. Petersburg. Today, as part of that wellness, we're going to talk about sexual health. A lot of times issues present. What do? You call upon her. We're going to get a lot of insight today. And this is for men and women, I do believe. And she's Lorraine Thorpe, the owner and founder of Thorpe Chiropractic and Wellness. Welcome back. How you doing?
I'm great. How are you?
Real good, real good. And I learn something every day. I didn't even know that this was also in your arsenal of things that you can do to help people. I mean, we've talked before about weight loss. Certainly you do Botox fillers and things like that. In addition to chiropractic, I'm just scratching the surface here, but also one of the other things that you help people with is intimacy and challenges along with that. So where do we start today?
All right. So let's start with men.
Okay.
We'll start with issues with men, issues with women, and therapies that cross over with both. Cross over with both. So men, mainly we see issues with men that include erectile dysfunction. I've seen people as young as in their 20s. Peyronie's disease, which is a calcification on the penis, where it'll actually, the penis will start to bend. Very painful. It's plaquing just right under the surface, alongside the muscle. So it's not fun for guys. So there's a lot of different treatments out there for erectile dysfunction. Most of the time, men are taking meds, Cialis, Viagra. And sometimes they work and sometimes they don't work for people. So as well as the people get injections, there's the P shot. But what I've seen to be most successful for cases of erectile dysfunction is GainsWave, which is essentially an acoustic sound wave that we do directly over the blood vessels on the penis and around the penis and the scrotum. Specific areas to break up the calcification in those blood vessels that's inhibiting the blood flow, that's in turn making it hard for men to get an erection and sustain an erection. So yeah, really successful. It works 99% of the time for men. It's pretty amazing.
So how does one know? Because there's different thoughts that many have with ED, whether it's psychological, whether it's physical. Where do you go from that point?
Okay, so there are cases where it's psychological, but just if 50% of men over 50 struggle with ED, and it increases by 10% every decade of life. So 60% of men over 60, 70% of men over 70. It just happens because as we age, our bodies lay down plaque, whether it be in our joints by laying down bone, giving us, and then resulting in osteoarthritis, and then in our blood vessels. You don't really know until they're not functioning correctly. So when it comes to sexual health, for a man to be able to get an erection and sustain an erection, he's got to have good blood flow, right? Because that's what creates that swelling and the girth. And it not only is it important for a man to be able to get an erection just for the whole pleasure side of it, but without being able to get an erection and finish, it becomes risky to your heart because you're not getting any blood flow back up to your heart because your blood pressure down in that area can be upwards of 400. So it's very important for it to pump back up into your heart. So it's risky to not be able to get an erection. Now, when we're talking about psychological issues, and we've seen that before as well, but rarely I've seen that. There tends to be a psychological side to it, just because it becomes an issue for a man and for their confidence. But I see that mostly with younger people. And I think that's a whole nother area. And, but when people are, younger people are exposed to porn in being so easily accessible, where that tends to be an issue there. But typically with men over 40, and then again, men over 50, you're really looking at plaquing in the blood vessels.
Hmm. So
Mm.
interesting that we're learning a lot here
Yeah.
today. With with this Gaines wave, now this is
Yeah.
high frequency radio waves, if you will.
Nope.
It's not. Okay.
It's actually shockwave. It's an acoustic sound wave, totally different. So um, it produces a sound wave, and we actually will use shockwave to break up kidney stones or non-healing bone fractures at a therapeutic level, but also to create enough vibration to break up calcification in the blood vessels. So you have increased blood flow, so that so then you can get an erection. And what happens, what's great about this is, you know, different than when you take meds for that same reason, is that you have that spontaneity. You don't have to wait, you don't have to plan for it. They Men tend to get that spontaneity back, and it's nice. It really does work. I've had guys that are in their 80s who have had prostate cancer and gone through treatment. That happens a lot, where they have trouble after those types of treatments, and get their function back. It's really great. Some men who haven't had an erection for 30 years,
Oh
and
my
they'll
gosh.
they'll get
And
function back. Yeah,
everybody's different. Every situation is
everybody's different.
different. With Gaines wave, how many treatments are we talking about to see the start of some results?
Okay, so typically when we're talking about mild to moderate, we're doing about 6 treatments, once a week for 6 weeks. We give you a little homework to do, and and then if you're really severe, it could take anywhere from 12 to 18 treatments. But typically, even with some severe cases, we haven't had to do much over 12 visits. And then, usually people will have to maintain. So they'll have to do like a treatment a year, a couple treatments a year after that.
Pretty amazing. And I have to
Yeah, it's
imagine
amazing.
uh, there's no pain involved in any of this. It's just sit, get the treatment, and leave. How long are the treatments typically?
Like 12 minutes.
Oh my gosh, really?
Easy, yes. And we'll do a little topical numbing, but I've never had anyone complain about pain at all. Not painful. So it's definitely worth it, because regardless of if you're trying other things, this is non-invasive. There's no drugs involved. So if you're and there's risk factors too, right? So you're at higher risk for having erectile dysfunction if you're on a lot of meds, blood pressure meds, cholesterol meds. That does increase because your body is increasing the cholesterol plaquing, right, in
Sure.
the blood vessels when you're on these meds. So throwing another med into your body is not only just hard on your liver, but there's all the side effects. So if you can mitigate, that alone, it's worth it to try something like this.
What if and meds now uber popular for so many and
Yeah,
some men might take meds just to amp it up, don't really have a major
yeah,
problem, but just more lead in the pencil maybe.
yeah.
Would this be, let's say somebody doesn't want to take meds, would this be another route to go?
Yes, and typically some of the men who do take meds as well, they continue to take them. It's perfectly safe to do this while continuing to take meds when you want a little boost, like you said.
Gotcha. Amazing. I'm
Yeah.
blown away that it's typically 12 minutes and fairly minimal number of treatments. It takes longer to drive to
Yeah,
your center than it does for the treatment
right,
for most.
right.
Fascinating. All right. So while while we're talking about men, other treatments available before we pivot over to women?
Yes. Yes. So I'm going to talk about another incredible, incredible device. I'm really big on the high intensity focused magnetic energy. So this we use for men and women. And when we do Gaines wave, we typically use this with those cases as well. It's called the Emsella, and you can see that on my website. They call it the Kegel throne. It's literally a seat, so you're not taking any clothes off. You don't have to, it's completely non-invasive, non-exposed. It is another 2.5 Tesla magnet. So it penetrates, and you just sit on it, and it penetrates that high fem through the pelvic floor. It goes about 10 centimeters in. And what happens is you're contracting all of those pelvic muscles. So think about this. And in turn, contracting the muscles surrounding the penis when it comes to a man. So that's increasing blood flow, causing contraction. A lot of guys see an increase in girth, increase in size because you're contracting those muscles. And you literally just sit on it. So for men, it works with urinary and stress incontinence. So because your pelvic floor starts to sag as you get older, and that's when we get leakage and stuff like that. So typically there's two protocols, one where you're lifting a 25-pound weight, one where it's like you're lifting a 100-pound weight 11,000 times in a 28 minutes session. And then, for men, we see that with aiding in reducing the issues with urinary incontinence and leakage, as well as FDA cleared for erectile dysfunction. So you've got two benefits for men. For women, we've seen unbelievable results with prolapse. So when the pelvic floor becomes weakened and you run the risk of prolapse, uterine prolapse, where it starts to fall out, with urinary and stress incontinence, but also with women, it causes a tightening in the vaginal canal. So, postmenopausal women, decrease in painful intercourse, increase in lubrication, increase in sensation. It's wild.
Wow. So this, I'm
Yeah.
assuming maybe what I was thinking and I've heard, this would be the radio frequency energy, if you will. This is that treatment.
Yeah. So this isn't radio frequency. This is high FEM, which is high intensity focused electromagnetic energy.
Okay.
So
Gotcha.
different. So yeah, so we've got acoustic sound waves with Gaines wave coupled with this, which causes the muscular contraction. And then yeah, and that works really, really well. And it's so easy. You literally just sit on this thing fully clothed. That
Eh,
one's so easy.
Is this for men and women?
Men and women. Yep. Yep.
Wow. Amazing.
Yeah,
How
it,
many
it
how
is
many
amazing.
treatments here? Now, what do we, again, every
So
situation is different, but what do you think?
right. So we do a series of six to begin with. Always they're always in six, but with the Mcella, typically we like to do that twice a week for about 3 weeks. When we're doing it for erectile dysfunction, we will typically do about 12 treatments. It's because you're coming in, that once a week for your gaze wave, and then we have you come an extra day just for the Mcella, and then you'll do the Mcella again another day. So works really well.
Just amazing. And
Yeah,
especially, this being different for women, for any pain that's involved, during intimacy and other issues, this
right.
addresses it, which just pretty amazing.
Yeah, and
Wow.
easy and non-invasive. So you're
Right.
not, for someone who is really hesitant about doing other therapies, because sometimes it could get a little, I don't even, some people just really do not want you going into their private areas for a treatment. But it's incredible. And I don't know if you've ever heard of pelvic floor therapy. A lot of people get pelvic floor therapy and they have to go through physical therapy, and it's difficult, right? And it's hard to do those Kegels when your pelvic floor is super weakened or the muscles are elongated. This is doing it for you. So it's using 100% of the muscle fibers in the area and doing 11,000 Kegels. It's unbelievable.
It's unbelievable.
It's
And many
incredible
times
technology.
when
Yeah,
you've got challenges, men or women, the pelvic floor exercises are one of the things that are suggested. Just a big
absolutely.
build up strength down there, et cetera, et cetera, et cetera. This is great for somebody who doesn't like to exercise. It's like gets it done.
Yeah, it's true. And when you really think about it, when you're talking about core strength, even for just that reason alone, when you're working that pelvic floor, we have a whole series called Core to Floor where you're doing the neo on the abs and doing the MCL for the pelvic floor, you create this solid girdle where you can combat a lot of other different ailments like back pain and hip pain and all of these
Yeah.
other things, along with the benefits that come with it. Aside from that, it's really great.
Well, when you think about it, it's connected to your core all within that
That's
area.
right.
And look at what that's doing. Everything. Everything.
Right. Yes, yes. People actually feel this contraction all through their buttocks, all through their, their private area and the perineum. Um, people feel it a lot. And we've actually had patients who are scheduled to get a sling. I don't know if you've ever heard of the sling surgery where to hold up the bladder in women when they start getting a lot of leakage after having kids. So we've had people do this therapy and not and to really just avoid that surgery altogether because their pelvic floor will lift enough so that they don't need to have any surgical intervention, which is really nice.
Hmm. Are these the only two treatments for intimacy, or you got other things going on there?
No, so just like for Gainsway for men, we've got um, a a treatment for women. Now this is internal and external, and it's 360-degree radio frequency. So it's called MFEM. So it's a wand. It's actually inserted, and the radio frequency, like radio frequency done anywhere else, it causes some subdermal trauma. And what that does is it causes the production, your body's natural production of collagen and elastin. So after, not all people do it after menopause. I've had a lot of young people do it just to tighten the vaginal canal, to make it look prettier down there. There's a whole bunch of reasons why we do that. It increases sensation, increases lubrication, it increases tightening. It's fantastic. So the radio frequency is 360 degrees, so it does that whole vaginal canal. Then there's another one we do after that, and that's externally on the labial fold. So we can take, a 70-year-old vagina and make it look really nice. We can lift those labial folds. Things just happen as we get older. Things start to hang and get looser, and it just skin loosens up. So radio frequency causes that tightening by producing collagen and elastin. So it's fantastic.
Wow. So, and I believe MFEM or technologies like it have been around for a few years. The stuff where, this is not just, hey, it just showed up. Maybe you want to try it. No, this has been tested. It's been proven over a period of time, right?
Oh yeah, yes, it's all FDA cleared. It's been around and there's a lot of different devices out there that do the same thing. What the reason why we brought on the MFM is because it's not painful. So it's not like some of the lasers can be rough and have a little downtime. There's no downtime with any of these treatments. You can do whatever you want. You can go home, you can have intercourse normally, you can do whatever you want to do. Go in the pool, whatever you want. So there's no downtime. So it's not like a laser where you're causing trauma to the tissue, the external
Which
tissue.
then would need to
Which is
heal.
very nice.
Right.
Right, right. So that's really nice, and it changes people's lives. Like even people that just do the MCELA, what might seem like something we take for granted, some people, even with just urinary and stress incontinence, just those symptoms, they can't even vacation because they'll go through 4 pads in a 3-hour flight. So they just won't fly anywhere. And that's really rough. So, this is definitely life changing for a lot of people. And it's something that we don't talk about enough. And it's interesting once you start talking about these topics, especially erectile dysfunction, then all of a sudden all these guys start talking to each other. And then we get
Right.
one guy and then four of his friends come in, and they'll like beat around the bush a little bit, but then and once they get the treatment, it's so not weird when you're in the room. It's really so not weird. Um, Even though it seems like it should be. It's very comfortable. It's not it's just yeah, it's really easy. Really easy.
Yeah, especially with the other treatment for men, I'm trying to
Mhm.
think of the Gains Wave, right? maybe the
Yes.
first time a man goes, like, well, this is a little different. Then the next time it's just like any other day, going, it's like and
Yeah.
your team,
It,
this is what they do, day in and day out.
yes. Yes. Right. Yep. And it's just myself and one other of my practitioners that do this therapy. So you're always getting the same people. There's no like, hey, I'm in here and you've never seen me before. It's not like
Right.
that. It's always this, we're always very consistent and, it's a very private area that we do these things. It's not, you're not walking in there and everybody knows what you're
Right.
doing. So it's very private.
It's
Yeah.
like, oh, wait, here
Which
comes
is
Jim
good.
again. Jim's walking in. He's getting Gainswave. That guy's getting Gainswave. He needs Gainswave. No. And you're 100% right. Men or women, all of this stuff, once one tells somebody else, it's almost like, wow, I didn't even know they
Yeah.
had that. Really? Yeah. And I'm
Yes.
sure it's the same thing when sildenafil and Cialis came along. People picked like, hey, try that. Oh, wow. Oh, now there's a compound and there's a med with both of them. Wow, I didn't even know that existed. People talk.
Right.
So, even talking about
Yeah.
this now, it's so funny, a bunch of years ago, nobody would ever talk about this stuff. Now it's
I
just like,
know.
take care of yourself. This is part of your health. It's not just, I just want to have fun. No, it's part of your health. And it can impede your health too, like you had talked about in terms of men, blood flow and all. Fascinating. Wow.
Yeah, it is. And what's interesting is people do feel a lot better overall because you're increasing blood flow and you're improving the efficacy of your blood vessels. So a lot of things improve along the way. And we always encourage, better eating habits and all of these things to contribute to better health overall because when you're all on a lot of medications, you are going to continuously create plaquing in those blood vessels. So we do work with people and work on their diet and things like that are really important so that these results last because you can take care these things can last forever, essentially if you take care of your body. And it's funny, like you said, people don't are get nervous talking about it, but then all of a sudden we'll be in the waiting room and somebody just came out and he's like, just talk it out like it's
Right.
in front of all kinds of people. It becomes not a non-issue after a while.
You know
Yeah.
what it is? It's like therapy. Back in the day, you would never even say that, going to see your therapist, 2 words, mental health, no, you don't even bring that up because
Right.
people look at you like you're a little off, a little weird. Now it's like, yeah, hey, Lorraine, I'd love to hang out later. Got an appointment with my therapist. We'll catch up. It's
Right.
respected as this is and should be. How do we
Yeah.
connect with you and the center if somebody's in the St. Petersburg, Florida area? How do they find you?
So you can go on our website, thorpechiropractic.com, or you can call or DM us at 727-328-8442 and come on in. We will show you all kinds of things. And actually we will demo the Mcella for people because they don't have to take their clothes off or anything. We will demo those and we at no charge, see how you feel. A lot of people tend to demo this thing and they're like, oh, this is amazing. I want to do this. It's
Wow.
really good.
2 words. So cool. Thank you. Thank you
Thanks.
for all the
Yeah.
insight.
Thank you.
And yeah, appreciate it. And we'll catch up soon. Okay.
All right. You have a great day.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.